Well, it's hard for me to know at this point because the Congress is rushing this legislation through without really giving the American people a chance to weigh in on their hard work. And what I've seen of the legislation so far is very concerning to me, and I think that there could be unintended adverse consequences to a public option. It could potentially drive private health insurers out of business. But it's hard for me to know that for sure because Congress hasn't given me a chance. I'm a neurosurgeon. I'm very interested in this subject, and Congress hasn't given me a chance to read this legislation, understand it, and develop an informed opinion. And as our representatives, I believe it's Congress's duty, especially on an issue of this magnitude, which affects us all, to allow the American people to see the products of their work, to understand the implications, and to weigh in on the subject. It seems that there is concern about letting us do that. The rush to put this through before anybody could possibly read a 1,000-page document is something that's in and of itself concerning to me. I applaud Senator Max Baucus's leadership on healthcare reform of bringing the issue to the forefront. I applaud President Obama's leadership on this issue. But again, I think that we are rushing and we need to have a long, hard look at this because our grandchildren and their grandchildren will live with the results. This is something that we should take the time to think about and to understand as a nation, not just 500 politicians on Capitol Hill over the course of a couple weeks looking at a bill and signing off on it and making backroom deals with various special interests. I think each and every American as an individual needs to understand what the proposal is and whether or not they want that, and then be able to have the opportunity to give feedback to their representatives, because Congress represents us. The Congress is given power from the people, and the people have the right to know what is up.